Good afternoon, everyone, and thank you for joining us once again today. I want to begin today by asking all of our licensed healthcare providers across the state to sign up for a new emergency alert system so that in the event of an urgent need, our public health officials will be able to ask you for your immediate assistance. This includes all physicians, nurse practitioners, registered nurses, physician's assistants, respiratory specialists, medics, LPNs, certified nursing assistants, podiatrists, dentists, anyone who has made a career in the medical profession. This is different than the siren system that's for doctors only. This is for emergency alerts for all our licensed healthcare workers. Please register on our website at illinoishelps.net. illinoishelps.net. Your fellow Illinoisans need you. Your state needs you. By signing up, you'll be joining an alert system that, when activated, will ask you to deploy to assist in our response to urgent needs during this public health crisis. Together, we truly can make a difference, and that difference will save lives. Again, I ask you to register yourself at illinoishelps.net if you're in the medical profession in any capacity whatsoever. Please go to that website and click on Register Now at illinoishelps.net. Additionally, thanks to your amazing outpouring of support, our healthcare workforce is expanding. We have now received more than 510 applications from former healthcare workers to get back into the fight. And we began sending out the expedited temporary licenses and permits yesterday afternoon. Still more healthcare workers are needed. If you have recently retired or left the profession to start a new career, please come back to work for at least the next few months to help us battle against COVID-19. This afternoon, the United States House of Representatives passed the $2 trillion emergency aid package, and we await the President's signature on that very important bill. I'll continue to work with our federal counterparts to bring in as many dollars home to Illinois as possible. I want to take a moment today to address some of the latest ideas that have been floating out of the Oval Office. President Trump yesterday went on a talk show to question whether Americans really need more ventilators to save people's lives. He did this on the same day that our nation overtook China and Italy, having the highest number of COVID-19 positive cases. To say that these comments are counterproductive is an understatement. And frankly, at worst, the comments are deadly. When I said that the bedrock of my decisions was science, I meant it. The equipment we have, the equipment we're still seeking, these are the recommendations of the best medical experts, epidemiologists, mathematicians, and modelers in the nation, all of whom have set aside their daily duties to help save as many lives as possible. We need exactly what we're asking for, perhaps more. If we don't get the equipment we need, more people will die. The President needs to use the Defense Production Act to put order into the market for ventilators and PPE. It will prioritize Americans over foreign countries and allow states on the front lines to access the equipment we so badly need. He needed to do this to activate the Defense Production Act weeks ago, or even yesterday, but it still will make a massive difference in our national health care system if he simply moves quickly. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones, calling across the world to get as much PPE, as many ventilators, and as many tests as possible shipped to Illinois. This morning, because of my state team and their hustle and working all hours of the day and night, we received another shipment of state-procured N95 masks, and they have been in the process of delivering stocks of PPE, that is our staff, to Champaign, to Peoria, Edwardsville, and Marion. We will not rest until each and every region of our state has what it needs. But without the federal government, individual states don't have enough market power to procure what is needed on their own. So I urge the President to join us in this work and take the federal actions that are available to him and to him alone. I want to provide you an update on what my team and I have been doing to ease the burden of this moment on our most vulnerable residents, our families, and our children. I'm glad to be joined today for the second day in a row by our Department of Human Services Secretary Grace Ho, whose staff has moved mountains and then some to increase the depth and breadth of Illinois' human and social services network, including easing access for newly eligible users and temporarily eliminating the renewal process wherever possible for organizations. We're also joined by Carolyn Ross, representing the nonprofit organizations across Illinois who are stepping up in this critical time. Most of you are adhering to our stay-at-home order, but not everyone has a home to go to. Not everyone has a safe home to go to. Not everyone has the same ability to put food on the table. Not everyone can stay at home with their children. These are problems that existed long before COVID-19, as did the need for a meaningful solution. But it is especially important right now that we are doing all that we can for all of our residents through this crisis. We want every eligible person to be able to access services as easily as possible. So I want to walk you through our ongoing efforts to simplify and expand the available support. As I go through these offerings, if you need any of these services, you can find more information on accessing all of these measures at our main coronavirus website, coronavirus.illinois.gov, coronavirus.illinois.gov. And please, whenever possible, do use our websites if you can. Although our regional offices remain an option for those who need them, for your own safety and that of our civil servants, I ask you to avoid visiting our offices if you can access the internet and get what you need online. First, let's talk about childcare. I announced exactly 1 week ago that we were going to make sure that our essential workers have safe daycare for their children while they do the critical work that keeps us safe. While children who can stay home should stay home, we want to make sure that every child in Illinois has a safe and supervised place to go. I'm proud to say that we've received more than 600 applications for small group emergency childcare licenses from people, organizations, schools, and communities looking to help their essential workers, from healthcare professionals to grocery store employees. Additionally, hundreds of our child care homes are staying online to provide care in socially distanced settings. And now we will be providing each of the providers who stepped up in this time of need with an additional stipend, $750 each for licensed homes, $2,000 each for centers running 1 or 2 classrooms, and $3,000 each for those running 3 or more classrooms. Applications for these grants will be available beginning Monday through your local child care resource and referral agencies, and again on our coronavirus website, coronavirus.illinois.gov. Parents and guardians looking to find child care should call our toll-free statewide number, 888-228-1146. Again, that's 888-228-1146, or to visit our Families and Children resource page on coronavirus.illinois.gov. My administration is also working closely with the statewide hospital and healthcare associations to make sure that our state's hospitals' childcare needs are being addressed. I also want to talk about food access, something top of mind for so many parents as schools have closed and layoffs have skyrocketed. First, I want to remind everyone that as long as schools are closed, students who qualify for free and reduced lunch can get their meals through their local school districts. And we continue to encourage school districts to work with our Illinois State Board of Education and the U.S. Department of Agriculture to expand their programs to all of their area kids. As for programs like SNAP and the Women, Infants, and Children program, WIC, my team at the Department of Human Services is submitting multiple waivers to the federal government to deliver as much nutrition support to as many Illinoisans as possible. Already, we've been able to automatically extend SNAP certifications set to expire March, April, or May another 6 months, until September, October, and November. We've also been able to waive the physical presence requirements for SNAP applicants and participants, enabling people to further reduce the time that they spend outside their homes and increase people's ability to apply for assistance online. Anyone who needs to apply for or to adjust their SNAP benefits can now do so remotely on our Department of Human Services website at dhs.illinois.gov. Again, if you need to adjust your SNAP benefits, you can now do that online at dhs.illinois.gov. We're expecting an additional $80 million in federal money to come to Illinois in April through the SNAP program. That's another $80 million of food on the table for our residents that also stimulates our local economies. That's real impact in our communities. And I'm grateful to the team at DHS for all their work to bring as many federal dollars as possible to Illinois. Illinois is also home to many residents who don't have a permanent home to stay in. DHS has gone through its budget with a fine-toothed comb and redirected millions of additional dollars to address all aspects of homelessness assistance statewide, with a focus on expanding our ability to offer temporary shelter. That's on top of the doubling my administration has done of the state homelessness prevention program over the last year. We're also increasing all of our existing state homelessness service contracts by an additional 5%. That means more dollars to homeless shelters and permanent supportive housing. These extra dollars will help our partner organizations enact social distancing measures within existing spaces. Finally, if you're experiencing domestic violence or you live in fear of it, I know how much scarier and more complicated the message of stay home might sound to you. If that's the case for you, please know that you can call our Illinois Domestic Violence Hotline at 1-877-863-6338. Again, if you are experiencing domestic violence or live in fear of it, you should call our Illinois Domestic Violence Hotline at 1-877-863-6338.